Hello, welcome to this new video. I'm Maestit Polo and together with my colleagues Fabian Ricardo and Ana Ayala, we will be providing you with relevant information about 3 countries. Okay, let's start.
Hello guys, I hope that you are well. And today I'm going to talk about the Danish healthcare system. The Danish healthcare system is well developed, efficient, but quite expensive. If you have to ride in Denmark and you have a CPR number, you do not need private health insurance. The service. The Danish healthcare system is divided into sectors, primary and secondary care. Citizens tend to turn to primary care where everyone is assessed at GPA. The first contact in most circumstances and free health. Secondary care encompasses specialized treatment at hospital care. Denmark's public health system is one of the best in the world and one of the best financed of 8% of GDP is dedicated to health budget through a special tax cover as is universal and there is no copy payment. Educational system in Denmark. The educational system in Denmark is made up of primary, secondary, and higher education. Education is compulsory between the age of 7 and 16. Compulsory education consists of 9 years of primary and secondary education, with the possibility of an optional 10-year. Population: adults and young people aged between 15 and 24, and 12 and 67%, men 3,077, and women 35% of women in the Denmark. Okay, and the other thing that I need to mention about that is that the old state is financed through a tax of more than 50% on waste, which most pensioners have paid for 40 years. So it is most possible to take away a right that is protected by law. Side catcher. Denmark is a constitutional monarchy with a list of monarchs that has been maintained continuously for a period of more than 100 years, except for a period of interruptions between 132 and 140 plan of government.
Bolivia is one of the 3 countries in Latin America that have had the highest economic growth. It is a developed country with few industries and its economy depends mainly on primary and secondary activities. Of course, it exports various products such as natural gas, gold, fine ore, crude oil, sunflower oil, fresh vegetable, milk, and sugar, and among others. Likewise, it imports refined petroleum, cars, pesticide, delivery trucks, and crude iron bars. Okay, this beautiful country is vulnerable to climatic disaster. It is exposed to several risks related to the international context, such as the volatility of the prices of raw materials, global slowdown, the increasing international interest rate, and the increasing the prices of food. Okay, now it should be noted that it has social problems such as poverty and social inequality, and that the quality of life of its inhabitants is acceptable. Now, it is relevant to highlight that it currently has a life expectancy of 74 years. Education is compulsory to high school and free at all levels to higher education. So, the educational system is made up of physical educational institutions, that is, public, private, and academic educational institution. The whole system is unique It is made up of leading private institutions and is in charge of managing everything related to health. Okay? Likewise, it establishes that all Libyans have the right to universal, equitable, timely, and free access to comprehensive care. So it should be noted that approximately 12% of the budget of this country correspond to health. Moreover, it has a Ministry of Health and a staff of doctors, nurses, and other employments who are responsible for carrying out this system, right? However, it can be said that doctors don't receive a living wage. Generally, they still respect the right of children and give them the opportunity to be educated and to receive good health in order to have good development and healthy growth. However, there are more than 20,000 children abandoned by their relatives who live on the street and they don't enjoy their rights to health and education. So likewise, young and middle-aged adults are happy, enjoy the opportunities granted by the state or participatory and have good values. Therefore, it can be said that they enjoy good physical and mental health. On the other hand, more than 50% of the elderly have a disability, which does not allow them to have good health. Moreover, many of them are abandoned and disposed of their property by the family, resulting in major social problems in this country.
Afghanistan is an Islamic country located in South Asia, in which it has a population of 39,008,428 people. In its capital is Kabul. Okay, it can be said that this country has some different shortcomings and in certain files, such as its inhabitants have a very low standard of living, and this is according to the Human Development Index carried out by the United Nations. Now, talking about their health service, it is found that it's not the best, since their service was precarious for a long time, but with the arrival of the Taliban, which it is a conflict there, many hospitals closed. In addition, many of the a few hospitals that remain don't have access to the essential medicines. Likewise, it happens with private hospital institutions where the quality of care is low with high cost. Uh, cost and that if people have serious ailments, they have to move a nearby country to be treated, since private clinic in Afghanistan don't have what is necessary, or the consultation is too expensive for the clients. On the other hand, in the case of health workers, they do their best to provide life-saving medical care even if they don't have salaries. In that country, the situation is that health professionals have to decide who to save and who to let die. Moreover, another unfavorable fact is that the lack of operational health centers and female health personnel that causes patients to hesitate when seeking medical care. Therefore, Afghanistan's health system is on the brink of collapse as they don't have a strong health care system, lacking doctors, nurses, and workers essential for its proper functioning. This is due to lack of money, and they don't have financial support from the other countries. The situation in this country is quite complicated, as only 60% of Afghan children are in school today. Among adults, 28% of population is literature. In addition, the educational system lacks infrastructure. In Kabul, the classroom have more than 60 students, in which there are too many people to be in the same place. However, from the perspective of recipients of health structure, children are the most affected since the majority of Afghan population is in poverty. The infant mortality rate in Afghanistan is the highest in the world, and UNICEF reports quality Afghanistan as the worst place in the world to be born. In fact, Afghan children face misery, violence, and poor health care system on a daily basis. Their situation is dramatic. Infant mortality, malnutrition, public health system, food demand because there are very few hospitals in Afghanistan, and people sometimes have to travel hundreds of kilometers to receive care. The health system for young adults is deficient, and it is more difficult to obtain medical attention since they are forced to work from an early age and they don't have time to approach and do checkups on their health status. Middle-aged people, like the rest of population, are in the same situation as they lack a good health uh, service. The health system in the elderly is deteriorated since, according to the mortality rate, people only reach 65 years of age due suffering from various diseases such as cardiovascular and among others. Now, in terms of special care, it is said that that country tries to do the best it can according to the conditions in which it is, as in the part of mental health, in which certain people try to guide those who need it, especially those who is suffering from a crisis of the Taliban invasion.